Hello, my name is Caitlin and I'm one of the nurse coordinators here at Toronto Western Hospital Movement Disorder Clinic.
And I'm Alex, nurse practitioner in the DBS clinic.
Today we will be providing education on deep brain stimulation surgery. This video will help you and your family understand how to look after yourself at home after neurostimulation surgery at Toronto Western Hospital. In this video, we will cover how to care for yourself at home, what signs of infection to look for, when to go to the emergency room, and what to expect at your follow-up visit. In addition, you will receive a pamphlet in the mail with information. Your surgery will be done in one day or divided into two. You will be given your surgery date by the neurosurgeon's office. You will stay in hospital until your electrodes and battery pack have been implanted, and you will be discharged when you are stable. Usually you spend 1 to 2 days in the hospital.
Now we're going to talk about taking care at home after your neurostimulation surgery. First, incision care. Your incisions will have staples or stitches and will be covered with bandages. You will need to remove those bandages 3 days after your battery is inserted in your chest. After the bandage is removed, keep the incisions clean and dry. Do not apply any cream, lotions, or ointments to the area. Keep your head covered by wearing a scarf or a loose fitting hat when you go outside. Make sure you wash anything you wear over your head in hot water. Never touch, scratch, or apply any pressure on the incision sites.
Next, we will be talking about hygiene care after surgery. You can take a shower or wash your hair with a mild soap or shampoo 4 days after your last surgery. Please do not soak your incisions in water for the first 4 weeks after your surgery. For example, do not soak in a bathtub or go swimming or use a hot tub, anything where you'll be submerged underwater. Please make sure your hats, bed linens, pillows, and wigs are all clean. Stop pets from going close to your incisions and wash your hands well after touching them. In addition, please wash your hands often. If you have a scalp incision, do not dye your hair or use a hairdryer until after you visit your neurosurgeon, usually 6 to 8 weeks after your last surgery.
Next, we're going to talk about activity levels after surgery. So do not lift anything heavier than 5 pounds or 2.5 kilos for 3 months after the surgery. Do not play sports or engage in strenuous or tiring activities for 3 months as well. And do not do anything that could overheat your stimulator, such as using tanning beds, hot tubs, saunas, or steam rooms, until your incision sites are completely healed. After 3 weeks, you can start increasing your activity levels gradually, as much as you can handle. I always tell patients to listen to the body when you're starting to do activities. So if you feel that you're doing too much, it means you need to stop it. Lastly, please talk to your neurosurgeon about these or other activities that you are not sure about, such as traveling or returning to work.
You will need to make an appointment with your family doctor 10 to 14 days after surgery to have your staples removed. You will receive a staple remover from the hospital, and they will need to take the staples out of both operation sites in your chest as well as your scalp. Look at your incisions every day and please look for signs of infection. These may include increased redness or swelling at your incision sites, any leaking fluid, for example, yellow or green-like pus from your incision, bleeding from the incision site, pain at the incision site that does not go away, or as well as a fever, which is a temperature above 38 degrees Celsius or 101 degrees Fahrenheit. Any opening of the incision edges is another sign to look out for. If you notice any of these signs or symptoms, please tell your neurosurgeon's nurse coordinator as well as your nurse practitioner as soon as possible. In addition, go to your local emergency room or local doctor as you may need to be started on antibiotics.
Let's talk about when to go to the emergency department after the surgery. So if there's any sudden, unexpected change in your health, or any sudden, severe, persistent headache, or you have a seizure, or if there's any signs of infection as mentioned before, if you think that there are any signs of a stroke, or overall if there's any sudden, severe change in cognition, behavior, such as confusion, hallucinations, memory loss, change in personality, mood, especially depression or thoughts of suicide.
Talk to a member of the healthcare team before you restart taking any blood thinners after surgery. These may include Coumadin, aspirin, Plavix, rivaroxaban, or apixaban. Please keep taking all your other medications as you did before surgery unless your healthcare professional tells you not to do so. You may have a headache, pain around the incision sites or down the right side of your neck after surgery. This should slowly get better. Your doctor may give you a prescription for pain medication. Take pain medication when you need it and follow the instructions in the package. Please do not take any aspirin or Advil for pain directly after surgery, as this may increase your risk for bleeding. Tylenol Extra Strength works well after surgery.
Now, when you have a surgery, you will get a remote control, also called patient programmer. So the patient programmer is a small device that comes with neurostimulator. It lets you turn your neurostimulator on and off and make other adjustments once your system is turned on and programmed. You will be shown how to use your programmer during your follow-up visit with the neurologist or neurosurgeon, or before you discharge from the hospital. Do not try to use it until it has been turned on and you have shown how to use the programmer. Please remember to bring your programmer with you for every follow-up visit. You need to know that there are different models of neurostimulators that have different battery lives. Depending on the one you receive, you will be instructed on your first programming visit on how to monitor its life, and we will also check it every time you come to see us. If it needs to be replaced, we will arrange the replacement with the neurosurgeon before it is depleted. Most batteries last 2 to 4 years depending on how much energy they deliver to the brain. There will come a time when it will need to be replaced. It will be done within the day surgery clinic and do not require a hospital admission.
Next, we're going to talk about your follow-up visits. Don't forget to arrange an appointment with your family doctor 10 to 14 days after the surgery, once again to have your staples removed. You will need to have a follow-up appointment with your neurosurgeon 6 to 8 weeks after surgery. If they have not called you with an appointment within 2 weeks, please call the neurosurgeon's office to make an appointment. If you are a patient of the Movement Disorders Clinic, your next appointment for initial programming will be 6 to 8 weeks after your surgery. Your initial programming and follow-up appointments will be mailed to you. Your initial programming appointment will last 3 hours, and you'll come back to the clinic for 1 hour for the next 5 weeks, so we can slowly increase the stimulation and decrease the medication until we have achieved the optimum stimulation medication therapy. Please come to all of your programming visits off of your Parkinson's or tremor medications, and please stop taking these at midnight the day before your surgery. You should take any other medications as you normally would.
We want to talk to you about what you need to do to stay safe with the DBS system. So please follow these rules for your health and safety. Always carry your DBS registration card. Before you leave the hospital, you will get a temporary registration card for your DBS system from the company that makes it. A permanent card will be mailed to you. Carry this card with you at all times. Tell your healthcare providers that you have a DBS system. All your healthcare providers need to know that you have a DBS system implanted in your body so they can take steps to keep you safe. Consider getting a medic alert bracelet in an emergency. The bracelet tells medical staff that you have a DBS system. Never apply heat to your DBS system. Do not put heat to any part of the DBS system, as it could damage it and harm you. Do not have diathermy treatments, heat therapy, which deliver energy to heat and heal tissues in your body. Check your doctor or the manufacturer of your device before having any medical procedures. Most medical procedures are safe, such as CT scan, X-ray, or ultrasound, but some need extra precautions, such as MRIs, and others are not possible.
This concludes our video presentation, and we hope that you have found this helpful. If you have any further questions, please call our nursing line at Toronto Western Hospital Movement Disorders Clinic at 416-603-5800 extension 2356.